everyone, Anna here with the Coding Guild. Today we are going to talk about inpatient coding rules again. We will review how and why we need to pick a principal diagnosis, what is at stake, and what the rules are. Let's start by clarifying what the principal diagnosis is in practical terms. Well, in short, it's money. In most cases, for inpatient stays, the principal diagnosis will decide how much reimbursement a facility receives. Whatever the principal diagnosis is, will get plugged into the MSDRG grouper, the software Medicare uses to help calculate payment for acute episodes of care, but then performs all kinds of calculations and logical steps and assigns the patient to one of the MSDRGs, the diagnosis-related groups. This will determine how much the facility gets paid for this given patient. If we assign the wrong principal diagnosis at the beginning of this process, the case will either not get paid at all or will get paid but at an erroneous rate. When incorrect payments happen, two things can follow. 1. The hospital can go broke from all the unpaid treatment they provided but coded wrong. Or 2. The facility makes a lot of unjustified profit on services provided but upcoded, and they will get in trouble for that. As you can see, assigning the principal diagnosis correctly is imperative, not just from a financial but an ethical viewpoint as well.